right, so today is not a lot of writing, just a lot of me talking.
That's cool.
So if we look at this diagram, obviously we have fetus developing. This is close to the end of pregnancy. How do we know that? Nick?
It's upside down.
Yeah, because its head is on the bottom. That's usually how, towards the end of pregnancy, as a woman's getting closer to giving birth, usually the fetus will turn so that the head is facing down. And so this is towards the end of the development. Now, if we look at the diagram, we have here, these are sort of cut so you can't see where they go, but what would you call these tubes here? Two of them. Joe? Yeah, those are the fallopian tubes, or the oviducts. And so up here would be the ovary somewhere. So again, when this egg cell was fertilized and was then a zygote, it traveled down this fallopian tube. It took several days, just about a week, until it got into the uterus. And then it basically came in and stuck to the side of the uterus. And then the embryo started to form, the placenta started to form. Remember, as it was traveling, the lining of the uterus was getting thickened with blood vessels. Okay? It was getting ready for this embryo. That embryo implanted, and stuck here to the side, and started to grow. So what is this organ? This sort of the whole thing here, Maggie? Yeah, that's the uterus. It's a muscle. It's a sort of a hollow, a balloon-like muscle. It can expand drastically. Okay, when the woman's pregnant and at the end of pregnancy, it's expanded, it's very large. And then after she delivers the baby, after a little while, it'll get back to its normal shape. So it can expand and contract quite a bit, this uterus. On the wall of the uterus, where the embryo attached, is this organ. What would that be? Jacob? That's the placenta. So what do all these lines in it represent? What are all these lines? Rachel? Yeah, they're blood vessels. The placenta is basically this organ that's just filled with blood vessels, because remember, that's where nutrients, oxygen, waste products are diffusing back and forth from the mother's blood into the fetus's blood and vice versa. So it's filled with blood vessels. In fact, if you look at it, it's this big, sort of floppy thing, just filled with blood vessels, kind of all bluish in color. That's what it is. Placenta? The blood vessels, there's some larger ones, and then they turn into capillaries eventually, but you can see big blood vessels in it. Connected to the fetus? Chris? Yeah, it's the umbilical cord. And again, it has blood vessels in it, arteries and veins. Arteries that carry blood from the fetus's circulatory system to the placenta, and then veins which bring it back. Now, a lot of times people make a mistake when they're answering questions about this, because they'll say, if I say, what gives the fetus oxygen? A lot of times people will say the umbilical cord. That's not really correct. What's the best answer to that question? What gives the fetus oxygen, Dan?
Placenta.
Yeah, the placenta does. The umbilical cord really is just sort of carries blood vessels to get to the placenta, but it's the placenta that's giving the oxygen and nutrients to the fetus's blood. Okay, the umbilical cord just sort of brings the blood back and forth. Where was your umbilical cord attached to you?
Your belly button.
Your belly button is the scar from where your umbilical cord once connected you to a placenta inside of your mother. It gets cut after the baby's born. The umbilical cord gets cut, and the nurse will usually put like a little plastic clamp on there, and they'll tie a little string and tie off very close to the baby's abdomen, and then It'll turn black eventually. There's just a little section that's left, and after a couple weeks, it turns black and kind of falls off, and then the baby's left with their belly button. And how it heals and all that kind of stuff determines if it's an innie or outie. That's what people asked last year. But it gets cut and sealed off. Now, how about this? What is this fetus inside of? Think back to the fertilized chicken egg. It's the same thing with the chick embryos in it. Remember what it was called, Anna? It's a membrane. It has a name. It's called the amniotic sac. And it's filled with something that's called amniotic fluid. The fetus is sort of floating in this little bubble of this fluid. What do you think its purpose is? Why is it in this bubble of fluid? Joe?
Because, like,
No, not so much.
I don't know, that's also.
Yeah. Doesn't use it really for anything. It's for protection. It's for cushioning. You know, a baby's surrounded this little bubble of fluid. It's kind of floating there. It can absorb any shock as the mother's walking around or moving. The fetus isn't like bouncing around in there. It's just in this little bubble. Look here, floating in the middle of a pool. In fact, now if this fetus is in a bubble of fluid, why doesn't it drown? Its lungs are filled with this fluid. It can't breathe. So how does it stay alive? Jenna?
Because it hasn't, like, breathed yet. So
Right.
it doesn't,
What?
like, need air yet.
Right, but it needs oxygen still, so how's it getting it?
Through the, what did you say before?
Yeah, it's getting it through the placenta. The fetus doesn't need to breathe. In fact, it never will take a breath until it's actually born. Its lungs are usually filled with amniotic fluid. Doesn't need to because it's getting all the oxygen directly from the placenta. And so its lungs don't work. When, I'll answer your question in 1 minute, but as the embryo is growing, different organs develop at different times. The brain and the nervous system is one of the first. The heart is one of the first organs. The lungs and respiratory system is one of the last. Same thing with the digestive system. Because they're not necessary until the baby's actually born. The fetus never needs to eat anything when it's in the womb either. Again, it's because it's getting nutrients from the placenta. It doesn't eat at all. Yeah?
So you know how it's in, like, that bubble thing?
Yep.
When you give birth, like, where does the bubble go?
Well, we'll talk about that in like 3 minutes. Okay? So I'll answer that question in 3 minutes. Go ahead, Joe.
Like, when the baby is born, how does it go that fluid out?
The fluid of its lungs.
Yeah.
The process of being born, labor and delivery, and squeezing the baby out, all of that sort of squishes a lot of this fluid out of the baby's lungs. And after the baby's born, it'll sometimes like be coughing and sputtering and getting some of that that's left over, getting some of that fluid out of its lungs, and then basically it cleared out. So a lot of that comes out as it's in the process of being delivered.
So where does it come out? Like, it's
Out of its mouth, yeah.
Oh.
Yeah, it's like if you had water, you inhale some water in your lungs, and then you cough it up. Yeah. So fetus never breathes, never eats until it's actually born. And in fact, that's why if a baby is born premature, because the lungs are one of the last organs to develop, often a premature baby, their lungs aren't working properly. And if they're born premature, then they have to be put on a ventilator to help them breathe until their lungs can finish development, because it doesn't need the lungs until it's born.
I know one guy, I mean, he's not lying before, but he had surgery, so he had like one lung, and he's like surviving.
Yeah, some people can survive with one lung. Sometimes people like one lung might collapse or might have damage, or they may have had part of it removed because they had lung cancer. But yeah, you can live with a single lung. So also, even some women even give birth in water, in like a tub of water. Sometimes people feel like it's easier on the fetus because it's going from a warm, watery environment. It can be born into a warm, watery environment. And it's okay. Even after the baby's born, if it's underwater, it's still going to be able to get oxygen through the placenta for a little while. And so Some women do have that happen.
But what if it like starts screaming? Is it?
Well, it doesn't, again, as long as it doesn't matter because as long as it's attached to the placenta and the placenta is still attached, it's getting oxygen through that. Once they cut the umbilical cord, or once the placenta detaches, well then it needs to start breathing on its own. But until then, it can get oxygen through the umbilical cord through the placenta. So this is the fetus. And then finally, here at the bottom of the uterus, this opening. I guess it's not an opening now, it's sort of sealed shut. But Maggie? That's the cervix. During the time when a woman's pregnant, the cervix is sort of sealed up. So let's talk here for a minute about, all right, well, how does the baby actually get born? So, what is, how many people have had relatives that's been pregnant recently you can remember, or a mother, or father, or somebody? Okay. So, what's the first thing that would happen? So, when a woman's pregnant, so she's getting close to her 40 weeks. She knows she'll probably have a baby sometime soon. What's one of the first things that happens that tells her she's going to be having this baby in a day or so? Well, sometimes she gets contractions weeks ahead of time, even mild ones. There's something else. John? Her water breaks. And you asked this question a second ago. So when a woman's water breaks, it's pregnant, and what happens is this amniotic sac that surrounds the fetus and is filled with amniotic fluid, it breaks, it ruptures. And this amniotic fluid leaks out. It comes out through the cervix, through the vagina, and that's what it means when a woman says her water broke. She doesn't have any control over it. She doesn't know when it's going to happen. It just sort of happens when she's going to be having the baby. Sometimes it doesn't happen, but often it does. And so that's what it means when a woman's water breaks, is that this amniotic fluid leaks out. And she knows she didn't urinate because she didn't have a full bladder. It's just this water leaks out, and she says, okay, she's going to be having this baby in 24 hours or so.
What happens if, like, you know, the baby's ready to come out, but it doesn't first?
Yeah, it does. Like, for my youngest daughter, my wife's water never broke. She just went into labor. And sometimes the doctor will rupture the membrane on their own. They have this long pointy tool, and they just sort of poke it, and it ruptures the membrane. And usually that speeds along labor a little bit once that amniotic sac ruptures. And once it does break, the doctor wants the woman to have the baby within about 24 hours. Because this amniotic sac also serves to seal off the fetus and the mother from any bacteria getting in. So once it breaks, it's possible that bacteria can get in and could start an infection. So really, once a woman's water breaks, if she hasn't had the baby in 24 hours, usually the doctor will induce labor, which means give her certain medications that will cause labor to start and happen more quickly. So that's usually the first sign, a woman's water breaks. And then Joe mentioned contractions. So then, at some point, contractions start. When did we already talk about the contractions? And what body system? Contractile vacuole you mentioned. That's squeezing of that little thing in the paramuscle. We talked about contraction in another body system. What can you contract? Your bicep?
Muscles.
Your muscles. Contraction is when your muscle tightens, it shortens. Okay? And the uterus is a muscle. It's just a hollow, balloon-like muscle. And so contraction is when the uterus muscle tightens up. Okay? And so contractions begin. At first, they're like mild. A woman can feel that she's having them, but they're usually not that intense. They don't hurt. And they're spaced out. It could be, 15 or 20 minutes before she gets another one. But as her labor is moving on, the contractions start to happen more quickly. There's less time in between them. They start to also get more intense and stronger. At the end, they start to become painful. And so these contractions start happening faster and faster. And what's happening is the uterus is contracting. It's starting to move the fetus and starting to push the fetus down through the cervix. That's why these contractions happen, to sort of squeeze the fetus and start to move it along so that the baby can be delivered. Okay, so she gets these contractions, and they get closer and closer. Usually, like after a woman's water break, she might call the doctor and say, okay, my water broke. And the doctor may say, well, okay, why don't you come in when your contractions are 7 minutes apart or whatever. And so she probably, they'd be getting closer and closer. Once they get to that point, she might go to the doctor, go to the hospital, wherever. And they're going to get closer and closer, more and more intense as labor is progressing. And the other thing that's happening as these contractions take place, the cervix, which was closed, starts to open up. It starts to dilate. So if you ever heard people talk about somebody that's in labor and they're 2 centimeters dilated or 4 centimeters dilated, it's talking about the cervix because it goes from closed, completely closed, to open 10 centimeters. And that's big enough to allow the fetus to come out. And so the doctor can check. The doctor can feel how many centimeters dilated the woman is. He may tell her and say, okay, you're 5 centimeters dilated, so a while to go until you're fully dilated. So after the contractions continue and continue, the cervix gets dilated, the baby is moved, starting to move through the cervix. Now all of this, the woman doesn't have any control over. She's not like making the contractions happen. They just happen to her. Okay? And so that this just goes quicker and quicker. And then the baby starts to move through the cervix and into the birth canal, into the vagina. Once we reach this point, then that's called delivery. So the first part's called labor, sort of the part the woman has no control over. But then when delivery starts, that's about the woman actually pushing the baby out. And that she does have control over because she has to use the muscles of her abdomen, the muscles around her pelvis, to actually push the baby out. And so the baby starts to move through the cervix, comes out head first usually, goes through the pelvis, through the bones, has to fit through those bones. It turns halfway through to allow the shoulders to fit through because it fits better in a certain direction. And so it turns to fit the shoulders through. And this whole time the mother's pushing the baby out, eventually comes through out the vagina, and the baby's then born. Sometimes the baby's not in the right position. Somebody mentioned earlier. So what's it called if like the feet are first instead of the head? Anyone know the name? Well, they might do a C-section first, but there's a name for the position. You ever heard the baby's in a breech position?
Oh, yeah.
That means that it's not head first. Now, a baby can be born vaginally, feet first, but it's harder. It takes longer. It doesn't quite fit through as well, feet first. So sometimes if the baby's in a breech position, it's not progressing through the birth canal, they may do a C-section, which we'll talk about in a minute. But normally, head first is the normal way. And after the mother pushes the baby out, it's still attached to the umbilical cord. The umbilical cord still goes out of the baby into the mother, and it's still attached to the placenta. But then after a short time, the placenta detaches. It breaks away from inside of the uterus. And the placenta comes out afterwards. So after the mother gives birth to the baby, the placenta comes out just a short while after. And it's actually important, the doctor, after she's done, the doctor will feel on the woman's abdomen to make sure there's no piece of the placenta that broke off inside of her. Because if it stayed inside of her, it could start to break down and become infected. And so they have to make sure all of the placenta came out. The doctor will usually inspect it later on and make sure it's all there and it's intact and looks healthy. So the baby's born. They'll clamp the umbilical cord. Somebody will cut it. Sometimes the father cuts the umbilical cord. Sometimes the nurse will cut it. And after the baby's born, they'll usually try to immediately, they might suction out mucus out of the baby's nose and mouth so it can breathe well. And then they'll usually give it right to the mother, right after birth. Right after the baby's born is the most alert the baby will be for weeks. There's like a period of time after birth where the baby's awake and alert and looking around. Usually they'll give it to the mother so that she can start nursing right away. And it's a time when the baby can bond with the mother because the baby's very active. You know, after a little while, then the baby sleeps a lot. But in the first hours after birth, the baby's very active. So they'll try and give it as much time with the mother as possible. Now, if there's any complications, they may have to take the baby to get a medical treatment and whatnot, or if the mother needs treatment, they may not be able to do that. But they'll try as much as possible to give the baby to the mother right away. Jenna?
What happens if like the umbilical cord like comes off inside?
Comes off inside, you mean after the woman gave birth?
No.
Or while the woman's still pregnant?
Yeah.
And so that does sometimes happen. If the placenta starts to break away, if it partially breaks away, it might be okay. If it fully breaks away, then the fetus that's growing can't get the nutrients and oxygen it needs. If it's not far enough along, it won't survive. But if it's like close, they might do a quick C-section to try to get the baby out. But yeah, sometimes the placenta can break away. But if it's partial, it can be okay because there's still enough attached to give the fetus what it needs. So this is called vaginal birth, natural childbirth, where the woman pushes the baby out through the vagina. And that's the preferred way. It's the easiest recovery for the mother. She can recover from it just in a couple days and be active and caring for a baby and so on. But sometimes it doesn't think there are problems. Sometimes the baby is not coming through the birth canal and is sort of stuck and not moving. And the woman's been pushing for a long time. Sometimes the baby is in some kind of distress. It's not getting oxygen that it needs. Like sometimes the umbilical cords can get wrapped around the baby's neck. Sometimes it can become sort of kinked like a hose or stretched and blood's not going through it as well. When a mother is in labor, they put a strap around her that can monitor the baby's heartbeat inside of her. And if it drops down, then they may look closely to see if the baby's in distress. Like at one point when my wife was giving birth to our youngest, we were in there and it was getting close to the end. She was in labor, but they were watching the fetal heart rate monitor, and all of a sudden it went way down. And so the nurses, they like have an alarm that goes off. They rush in and they flip my wife from one side onto the other side, and then the baby's heart rate came back up. It was just maybe the baby was like pushing on it or something. By moving my wife, it just moved things around and it was fine. But they keep a careful eye on that. But if it's not helping, if the baby's heart rate's dropping, if its oxygen levels are low, they may say, well, we need to get the baby out as soon as possible so it doesn't suffer any negative effects. So then they might do a C-section. In a C-section, it's surgery. So they bring a woman into surgery. They give her the anesthetic so she has no feeling from like her waist down. And they do surgery. They cut through her skin and her abdomen. So they cut through her skin. Then below that are her abdomen muscles. They have to cut through those. Then below that is the uterus. They have to cut through that. And then will be the amniotic sac. They'll have to break the amniotic sac, and then they bring the baby out through her abdomen, through this incision that they made, rather than it being born through the vagina. So they pull the baby out, and then they have to suture up, sew up the uterus, sew the abdomen muscles, sew the skin. So afterwards, all that stuff has to heal. So usually after a woman has a C-section, it's a couple weeks before she can be like active and driving and moving around as much. So it's a longer recovery for the woman from a C-section versus having a vaginal birth.
Won't you have a scar from that?
Yep, you'll have a scar from it. And if you have one baby from C-section, usually, and you get pregnant again, usually they do the next ones through a C-section also, because if you go through a natural vaginal birth, sometimes where the previous scar is from the first C-section, it could be like a weak point, and it could rupture during delivery. But you can have a vaginal birth after a C-section. They just take certain precautions and they monitor a woman closely, so you could do both. But oftentimes after one C-section, all the rest of the women's babies, they schedule a C-section.
My cousin said two of those for her kids, and she said for her first one, like she was awake the whole time, and like the doctor and her sister were just like talking like it was a regular conversation.
Oh yeah, yeah, yeah. You are awake. Like usually, the woman is like you know, they put like we have a video and I'll show you probably
Oh, I
tomorrow.
don't want to sleep.
So like they have like a curtain so the woman can't see like your incision and everything, but she's awake. They give her an anesthetic, or even when a woman's having a natural childbirth or a vaginal childbirth, you can have different medications you could have. So you probably heard of an epidural. Is when they put an anesthetic, they put a needle in like between your vertebrae and inject an anesthetic in around your spinal cord, and it basically takes away any feeling from like the waist down, so a woman doesn't have the pain of contractions and delivery and so forth. Other times women get like a medicine in their IV that takes away some of the pain or relaxes them somewhat, or someone may have no medication at all and just have the vaginal birth and don't have any medication and just deal with whatever pain there is. And some women choose not to have any medication because some of it can get to the baby through the placenta. Also, some women want to be like awake and aware and ready to bond with their baby right afterwards, where if they have some types of medication, they may be not quite with it or so on. So it sort of depends on the mother and what she wants to do. All right, any other questions about childbirth or delivery? So again, this is I think this is computer generated, but it looks like we do have images. They do have these little fiber optic cameras they can use to get images of a fetus as it's growing and developing. So here, this will be at the very late stages. It looks like a baby. You can see the umbilical cord and the placenta. Earlier on, this is what things look like. Again, this is all the uterus. So when a woman's pregnant and her abdomen's swollen up, it's filled basically with the uterus. At the beginning stages, it doesn't look very human-like. This is a human. You can see this is the beginning of the placenta and the umbilical cord, and this is the actual embryo. But as time goes on, pretty quickly it becomes to look, more familiar. Again, you see the umbilical cord. You can see the blood vessels inside of it. And this is from that bodies exhibit. Okay, this is a pregnant woman with the abdomen opened up and a fetus growing inside of it.
Oh, they killed the president.
No, they didn't kill the people that are in those exhibits. Don't kill them. They've decided that when they do die, they're going to give their body to this museum. So somebody died naturally, and then
She died pregnant?
yeah, sometimes people die pregnant. Yeah. Sometimes if a woman is pregnant and far enough along, and she dies somehow, and the fetus is still alive, they often will try to remove it quickly to try to save the baby. Jacob?
I thought umbilical cords were not so loose. I thought it was a tight, kind of like a tight rope.
You mean how long they are?
Yeah, I thought it was kind of really short.
No, they're pretty long. I mean, they're like this long or so. I cut through my daughter's umbilical cords after they were born. Sort of rubbery kind of thing. Some people they take home the placenta and plant it under a tree or something.
Why?
Some cultures they cook and eat the placenta.
Ew.
That's gross.
A lot of animals will eat the placenta after they give birth to their young, to their offspring.